If you took your shoes off right now and looked closely at your feet, really looked, would you know what you were looking at? Most people wouldn't. And that's exactly the problem, because your feet are one of the earliest places your body shows a blood sugar problem, often years before a fasting glucose test at your doctor's office would catch it. Consider someone like a man in his early 60s, call him Robert, the kind of case this pattern shows up in constantly. Robert wasn't diabetic, or so he thought. He'd noticed his feet felt a little asleep some mornings, chalked it up to old shoes, and didn't think twice about a small cut on his heel that took almost 3 weeks to close up. It wasn't until a routine physical, almost a year later, that his fasting glucose came back high enough for his doctor to say the word prediabetes, and when she looked at his feet, she told him something that stuck with him. The feet had been trying to tell him this story for months. This is an illustrative, composite example, not a real patient, and I'm not a treating physician. But the pattern is well documented, and it's exactly why I wanted to make this video. A quick note before we go further, I'm not your doctor, and nothing in this video is a diagnosis or medical advice. This is general education based on published research. Always talk to your own doctor about anything specific to you. Here's my promise. I'm going to walk you through the 4 things your feet do when blood sugar starts running high, the actual mechanism behind each one, and, most importantly, the exact line between worth watching and call your doctor today. Here's the idea that changes how you look at your own feet. High blood sugar doesn't attack your body all at once. It goes after the smallest, farthest away things first, and your feet are the farthest point from your heart, fed by the smallest blood vessels and nerves in your entire body. Think of your circulatory system like a city's water grid. Your heart is the main pumping station, and the big pipes, the ones that run to your heart, brain, and major organs, get repaired and prioritized first when something goes wrong. Your feet are like the very last house at the end of the very last small pipe on the grid. When something's straining the whole system, that last house is the first to lose water pressure, and the last one to get fixed. Elevated blood sugar over months and years does 2 specific things to that last house. First, it damages the tiny nerves, a process doctors call peripheral neuropathy, which is why numbness, tingling, or that walking on cotton feeling often shows up in the feet before almost anywhere else. Second, it damages the tiny blood vessels themselves, reducing circulation to the skin, which is why the skin on your feet can change texture, color, and healing ability long before a blood test flags anything. Neither of these things happens overnight. That's actually the good news, buried inside what sounds like bad news. Because it develops slowly, your feet give you an early warning system if you know what to look for and take it seriously instead of blaming your shoes or your age. The American Diabetes Association and the CDC have both been consistent on this for years. Foot changes are one of the most common early physical signs of elevated blood sugar, precisely because the feet sit at the very end of the body's smallest nerves and blood vessels. This isn't a rare complication reserved for people who've had diabetes for decades. It can show up in the pre-diabetic range, sometimes years before an official diagnosis. So the governing idea for everything we're about to cover is this: your feet are the last house on the water grid. When they start acting strange, it's often the earliest visible sign that something further up the line needs attention. This is the one most people brush off the longest, because it doesn't hurt. If anything, it's the opposite of pain, which is exactly why it's dangerous. The mechanism, consistently elevated blood sugar, damages the protective coating on your nerves over time, similar to the way insulation on an electrical wire can wear thin. When that insulation frays, the signal still travels, but it arrives garbled, sometimes as tingling, sometimes as numbness, sometimes as a strange sock that isn't their sensation. Especially at night. Picture it like a phone line with a damaged wire. The call still connects, but the voice on the other end keeps cutting in and out. Your feet are still calling your brain, the message is just getting scrambled along the way. Consider someone like a woman in her late 60s who noticed she could no longer feel a hot bathwater temperature accurately with her feet. Only with her hands, a small but telling asymmetry that's a classic early sign in the pattern doctors look for. Here's the line between nuisance and something worth addressing sooner. Occasional mild tingling after sitting cross-legged is normal for anyone. Persistent numbness, especially symmetrical in both feet, especially worse at night. Especially combined with reduced ability to feel a light touch or a pinprick, that's the pattern peripheral neuropathy research consistently associates with elevated blood sugar, and it's worth a conversation with your doctor, not a shrug. The safe action: don't self-diagnose or self-treat nerve symptoms with supplements you found online. Bring it up at your next appointment and ask specifically about a simple in-office monofilament test. It takes about 2 minutes and checks exactly this. Bridge: numbness is about nerves losing clarity. The next sign is about circulation, and it shows up as something you can actually see. This is the scenario doctors worry about most, because it's the one most likely to escalate if it's ignored. The mechanism: elevated blood sugar does two things at once to a wound. It reduces blood flow to the skin's surface, which means fewer of the nutrients and immune cells a healing wound needs actually arrive at the site. And separately, chronically high glucose has been shown to directly impair the function of white blood cells, the cells responsible for fighting off infection at the wound site. Think of a construction crew trying to repair a pothole, except half the trucks carrying materials can't get down the road, and the crew that does show up is working at half capacity. The pothole doesn't fix itself faster just because time passes. It sits there, vulnerable, for far longer than it should. Consider someone like a man who developed a small blister from a slightly too tight shoe. The kind of thing that would normally heal in 4 or 5 days, and 3 weeks later it was still an open sore, slightly discolored at the edges. That extended timeline, doctors say, is a meaningful signal, not just bad luck. The line between nuisance and emergency, a minor cut that's healing on a normal timeline, even slowly, is worth monitoring. A wound that shows no improvement after about 2 weeks, or one that develops redness spreading outward, warmth, swelling, or any drainage with an odor that crosses into call your doctor promptly. Don't wait for your next scheduled visit territory, because foot infections in this context can progress quickly. The safe action: check your feet daily, genuinely look, don't just glance. Especially the soles and between the toes, and treat any wound that isn't clearly improving within about a week as a reason to call your doctor, not a reason to wait it out. Bridge: slow healing is circulation and immune function struggling together. The next scenario is what you can literally see in the mirror before you feel anything at all. This is the sign most often dismissed as just dry skin or just getting older, and sometimes that's exactly what it is. But the mechanism worth knowing changes how you should respond. The mechanism, the same small nerves that carry sensation, also control the sweat glands in your feet. When those nerves are affected by elevated blood sugar, the feet can actually produce less natural moisture, leading to skin that's unusually dry, thick, or prone to deep cracking, particularly around the heels, cracks deep enough to become an entry point for infection, which circles right back to scenario 2. Picture your skin's natural moisture system like an irrigation system for a garden. When the control valve starts malfunctioning, some patches get shut off entirely and dry. Cracked ground is what's left behind, no matter how much lotion you pour on top from the outside. The line between nuisance and something worth watching: everyone gets dry heels sometimes, especially in winter or with certain shoes. But unusually persistent dryness that doesn't respond to regular moisturizing, especially paired with any of the other signs on this list. Especially with cracks deep enough to bleed, that combination is worth mentioning to your doctor specifically in the context of blood sugar, not just treating as a cosmetic skin issue. The safe action, daily moisturizer on the tops and soles of the feet, and if cracking is severe or recurring, ask your doctor whether it's worth checking your blood sugar alongside it. Bridge. Dry skin is the nerve to gland signal breaking down. The last scenario is the one most people notice last, but it's often the most visually telling of all. This is the scenario people notice last, mostly because it develops gradually enough that you stop seeing it, the way you stop noticing a slow paint fade on a car you look at every single day. The mechanism: reduced blood flow changes how oxygen-rich blood reaches the skin's surface. This can show up as skin that looks unusually reddish or dusky, especially when the foot is hanging down versus elevated, or as skin that becomes unusually thin, tight, and shiny looking over time, a visual sign that circulation to the area has been reduced for a while. Think of it like a plant that's been getting slightly less water for months. It doesn't wilt dramatically overnight. The leaves just slowly change color and texture in a way that's easy to miss day to day, but obvious if you compare a photo from a year ago to today. Consider someone like a woman who mentioned to her doctor that her feet always looked a little more red than the rest of her legs. Something her doctor recognized immediately as a circulation-related pattern worth investigating alongside a glucose check, rather than a skin condition on its own. The line between nuisance and emergency, gradual, mild color changes are worth mentioning at your next visit. But a foot that suddenly turns pale, blue, or cold, especially with new pain, that is a circulation emergency. And that specific combination means calling your doctor or emergency services the same day, not waiting for an appointment. The safe action: take a photo of your feet every few months. It sounds simple, but gradual color change is genuinely hard to notice in real time and easy to spot in a side-by-side comparison. Bring those photos to your next appointment if anything looks different. Let me be very clear about the line that matters most across everything we've covered today. A wound that's slowly healing is a bring it up soon situation. A wound with spreading redness, warmth, swelling, drainage, or fever is a call your doctor today situation. A foot that suddenly turns pale, blue, or cold with new pain is a call emergency services now situation. Those are 3 different levels, and treating a today level sign like a soon level sign is the single most common mistake people make with foot health after 60. I also want to say this plainly: none of this means your doctor did anything wrong, or missed something. Foot signs are subtle, appointments are short, and this is exactly the kind of thing that's easier to explain in 20 minutes than in a rushed checkup. If any of this sounds familiar, you're not imagining it, and it's absolutely worth a conversation. So here's the governing idea to leave with today: your feet are the last house on the water grid. Numbness is the phone line getting scrambled. Slow healing is the construction crew running short. Dry, cracked skin is the sprinkler valve losing its signal. Color change is the plant that's been quietly getting less water for months. 4 different symptoms, 1 shared root cause: reduced nerve and blood vessel function at the farthest point from your heart. None of this means you have diabetes. It doesn't mean anything is broken beyond repair. What it means is that your feet may be trying to tell you something worth checking: a fasting glucose test, an A1C, a 2-minute conversation at your next appointment. That's it. That's the entire ask. A safety reminder before we close: never start, stop, or change any medication based on anything in this video. If you're already on medication for blood sugar and you're noticing any of these signs, that's a conversation for your doctor, not a reason to adjust anything yourself. If this helped you understand your own feet a little better, do me a favor and send it to someone in your life who's always in a rush at their doctor's appointments. This is exactly the kind of thing that's easy to miss in 12 minutes with a busy physician. And tell me in the comments, which of these 4 have you noticed, if any? I read every single comment, and it genuinely shapes what I cover next. Because feet aren't the only place your body quietly shows elevated blood sugar, your fingernails do something surprisingly similar. and almost nobody knows what to look for. I've got that full breakdown coming next. Watch that one right after this. I'm Dr. Alex. Stay curious, stay careful, and I'll see you in the next one.